to another viewer question here. This is from Brenda Brett, and it reads this, Dr. Redfield. It says, President Trump is promoting hydroxychloroquine as a preemptive drug against coronavirus. If there is a huge uptake of that medication, will there be enough for those of us who need it for things like lupus and severe arthritis? How worried are you?
You know, Sanjay, I think you know this as well as I. And I went through the early days of my career taking care of men and women that were trying to live life with HIV. Clearly, we have the ability as physicians to use approved drugs for non-approved indications. Related to hydroxyurea, you know, my position would be this was a decision between the physician and the patient. Clearly, there's some laboratory data that shows activity, but as you know, that laboratory data doesn't necessarily translate to clinical benefit. There's a number of clinical trials that are ongoing that I think will be rigorous and answer that question definitively. But in the meantime, this is going to be a personal decision that a physician and a patient will make about whether they choose to use hydroxyurea for an off-label indication. I think we just have to see.
Can I just ask Dr. Redfield, because I hear that quite a bit, and I'm a physician, and people ask me, and I frankly, I don't know, because there isn't data, and I would typically say, no, I want data. You're a doctor. It's a decision between doctor and patient. Would you recommend it to a patient?
Yeah, I'm not going to recommend it and not going to not recommend it. I think, you know, Sanjay, you and I are very similar. We're probably similar to my friend, Dr. Fauci. I mean, you know, we're very comfortable in responding when we have data that is compelling, and I think this is where the studies are going to give it. CDC is an organization, as you know, you and I have talked about it before. We're not an opinion organization. We're a science-based, data-driven organization.
You didn't even answer the question.
An independent decision of these healthcare providers and patients.
That's hilarious.
That at this stage and at this moment in time, we're not recommending it, but we're not recommending it. We're recommending for the physician and the patient.
Will there be enough for lupus people and arthritis?
I mean, you worked, I know, a lot, and you know, did a lot of really